get started. Hello and welcome everyone to the next installment of our Spotlight on Methods and Tools webinar series. My name is Kristen Reed and I'm a research coordinator at the NCCMT, and I will be helping to facilitate and then bring you this presentation today. Today we'll be talking about the health impact assessments and featuring the National Collaborating Center for Healthy Public Policy's online course on the health impact assessments. As well as we have the pleasure of hearing from a colleague who's been involved in the HIA process and will be sharing some of the benefits and challenges they've encountered, as well as their own experience going through the NCCHPP's online course. So just wishing you a very warm welcome, and thank you to those who've joined us this afternoon. So just before we get started, there are a few housekeeping items that we'd like to go over. If you can, please use the chat box on the bottom right of your screen to post any comments or questions throughout the webinar. When using the chat, please make sure you're sending to all participants so other people can join and comment and weigh in. If you are having any connections or technical issues, there is a WebEx 24-hour helpline, and the number is posted on the slide here, as well as it will be posted in the chat box. And we do have Ben as well here, who you can connect with if you have any other kind of technical issues, and she'll help you the best she can. So just to let you know that after today we will be posting the slides and recording for this webinar. And you can access them through our webinars page on our website or on our YouTube and SlideShare accounts. We'd also like to highlight that this webinar will be offered in French this time next week for those who are interested. So we will be asking a few polling questions today, and we'd just like to get a sense of who's joining us. There will also be a few short evaluation questions at the end of the webinar, and it's really important to get your feedback, so please stay tuned for a little bit after. To answer the polling questions, use the panel on your right-hand side of the screen, and if you could, please make sure to press submit after selecting your response. So today, our first question, we're just trying to get a sense of who's joining us. So please let us know if you're joining by yourself, if you're in a small group of colleagues, or if you are joining today in a larger group. So I'll give a few moments for people to answer. It looks like most people are joining on their own, but we do have some small groups as well. So that's great. And I did also want to share some information that we learned from our registrations. So today about 90% of people are joining us from Canada, and over half are working in local, regional, provincial government or paragovernmental organizations. And we have quite a few different roles that are joining us today. So we have some people that are students, policy analysts, public health inspectors, program managers, and researchers. So quite the variety. That's really great to see. So we'll move on to our next polling question. And what we're really just wondering if you're familiar with the National Collaborating Centers, or if you've used our resources before. Yeah, so please press submit as you go through the questions, and I will share some of the results with you. So it does look, as you're answering, that most people are familiar with our centers. So that's really great to hear. There are a few that are unfamiliar. And I think this next question won't apply to those as much, but we will give you a short introduction about who we are and what we do. Our next polling question that we have is for those who are familiar with us. How frequently have you used resources from the National Collaborating Centers? So kind of if you've used them once or twice, or sometimes use them, often use them, or if you use them fairly regularly. We'd love to hear your experience. We'd also love to hear about how people have been using our resources, so please feel free to share any of that with us in the chat box, or get in touch on email, Twitter, or another social media, and we'd love to hear from you. All right, So for those few of you who are not familiar, the National Collaborating Centres are funded by the Public Health Agency of Canada and each hosted in a different academic or non-academic institution across the country. And part of why the National Collaborating Centres exist in the knowledge translation field is to reduce duplication, share learnings across jurisdictions, and help to identify gaps in knowledge and practice. We also, a large part of what we all do is act as a resource for training, professional development, and capacity building for knowledge translation and evidence-informed decision-making for public health in Canada. So as you can see on the map here, each center is located in a different part of the country and works in a different domain of public health. So I'm just going to spend a little bit of time introducing your two hosts for today, so the National Collaborating Centre for Methods and Tools and the National Collaborating Centre for Healthy Public Policy, and then I will introduce and pass it over to our presenters for their presentations. So the National Collaborating Centre for Methods and Tools really champions uses of different types of evidence in public health decision-making. We aim to compile the latest research and evidence for what works in public health, and we work with practitioners to develop those knowledge and skills for using different types of evidence when making decisions in their own work. As you can see on the slide here, the diagram on the left is really what we use to help guide our thinking around EIDM in public health. And the model on the right goes through and outlines the steps involved in the process we use to incorporate different types of evidence into our decision-making processes. So our goal is really to help build confidence in the public health workforce so that practitioners know they are making informed decisions about programs and policies that really affect the health of both individuals and communities. Next, we have the National Collaborating Centre for Healthy Public Policy, who we are featuring today. They are a center for sharing knowledge and expertise in the area of public policy. And as you can see in the slide here, their mandate is to support public health actors across Canada in their efforts to develop and promote healthy public policy. So without any more delay, I would like to officially welcome you and everyone to the Spotlight and Methods on Tools webinar series. As I mentioned, today we are featuring the Health Impact Assessment process and highlighting the NCCHPP's course to support HIA capacity building. So I will introduce our presenters at this time, and I'm very happy to introduce Tierno Diallo, who is a scientific advisor at the NCCHPP, and his expertise is in the use of HIA to assess the health co-benefits of climate change mitigation policies and experience integrating HIA into Quebec City's urban planning process. We'll also be hearing from Gabrielle Monceau, who is a planning and research officer at Montérégie Region's Public Health Department. And she'll be sharing her experience with HIA for the Regional Transit Authority's Strategic Transit Development Initiative. So thank you so much for joining us today to share your experience. And I will pass it over to you, Tierno, to get started on introducing HIA to us.
Thanks a lot, Christine. And hello, everyone. Thank you for joining us today. My presentation will focus on HIA and on the free online course on HIA. So, first of all, I will talk about health impact assessment as a tool to evaluate policy, program, or project regarding health issues. And second of all, I will talk about the free online course on HIA. So what is the origin of HIA? In fact, HIA combines two origins: environmental impact assessment, which inform its methodology, and health promotion, the basis for its value and its objectives. What is the definition of HIA as you see here, this is the most common definition of HIA formulated by WHO in 1999. There are two elements which are very important in this definition. The first one is that HIA can be applied to policy, program, or projects, while environmental impact assessment can only be applied to projects. And the other aspect which is very important is the distribution of those effects within the population. This is related to health inequalities. Now let's see what is the goal or the aim of HIA. HIA is a decision support tool. It is used to better inform decisions and to assist policymakers, to promote healthy public policy, to promote better cooperation between different authorities. That means HIA requires intersectoral collaboration, and also to try to maintain social equity and help address health inequalities, as we have seen on the definition of HIA. And also is a way to improve the health and well-being of population. So HIA aims to advance values like democracy, which means citizen participation in the decision-making process. Also equity. I know that there is another tool called Health Equity Impact Assessment. It's almost the same as HIA. The difference is that in this tool, at each step of the process, you have to ask which are the equity implication of the proposal under review. And also, another value is sustainable development. That means that HIA take into account the short and long-term effect. And the last one is ethical use of evidence, which means rigorous quantitative and qualitative evidence. In HIA, as you can imagine, we have a wide variety of evidence that should be collected using the best possible method. Here we can see the main characteristic of HIA. First of all, it is based on a holistic view of health, which means that HIA considers the full set of determinants of health, like environmental, economic, and social determinants of health. That's why we say that HIA is based on a holistic view of health. And also it's focused on policy, program, or projects outside the health sector. This is very important because the first objective of HIA is try to improve health and well-being of the population from policies or programs coming from outside the health sector. And it's also conducted before the implementation of the proposal. This is also very important. HIA is a prospective evaluation. It's not a retrospective evaluation. That means HIA has to be conducted before the project is implemented. This is very important. And it's also interesting in both positive and negative impact, while environmental impact assessment usually focuses on negative impact. And HIA use quantitative and qualitative approach, as we have already talked about that when we were talking about the value of HIA. And it's also concerned with the involvement of all the sectors affected by the proposal under review. That's why we are talking about intersectorality. When should an HIA be conducted? As I already mentioned, HIA is a prospective evaluation. Then the recommendation of HIA has to come to the decision maker before the project is implemented. And as you can see here, HIA is usually applied during the formulation of a policy. This is the stage of development of a policy, and the best time to use an HIA is to use it when we are formulating the policy, and that will be a very good way for having an influence in the decision-making process. Here we can see the step of the HIA process. The this figure shows us the step of an HIA. You see here we have like 5 steps. You can find in the scientific literature, sometimes some author, present the process with 7 or 6 or 4 steps. But those steps are very important. And the first one is the screening step. It is the first step of an HIA. And the aim of this step is to decide if an HIA is needed. Do we need to undertake to conduct an HIA? This is the first question. And if we decided that an HIA should be done, then the next step will be the scoping. The scoping aims to plan how the HIA should be done. We have to. This step is where you plan out all the logistics of the subsequent steps in the HIA, and where you identify all the plausible links between the proposal and health. After that, we have the appraisal step. The objective of this step is to determine through the collection and analysis of data the extent to which the proposal will affect health, the nature of this effect, and which population group will be affected by this effect. It means to estimate the potential negative impact and the potential positive impact on health of the proposal under consideration. And we have the step 4, which is the recommendation. The objective is to formulate some recommendation or to propose some action to attenuate or to mitigate the potential negative impact and to maximize the potential positive impact of the proposal on health. And the last one is evaluation and monitoring. The objective of this step is to determine the extent to which the HIA has been successful, both in terms of the process and its effect. Several tools have been developed for each of these stages. There are many tools to guide you through each step. Maybe we're going to have time to talk a little bit about this tool. Here we can see some example of HIA topics around the world and in Canada. These figures show us the diversity of the scope of HIA. It's not only a tool that we can apply on urban planning, but we can use HIA in different types of topics or projects like energy, like transportation, like agriculture, like social policy or economic policy. We have a wide range of topics that we can, for which we can use HIA. Here we can see the extent of HIA practice around the world. You have here some guidelines on how to use HIA around the world. And actually, we don't have a guide for HIA in Canada yet, but we are thinking about developing something like that. But you see that around the world, you have many guidelines on how to conduct an HIA, and you can use them and adapt them to the context on which you are working on. So now, that was a short introduction of what is an HIA and the value of HIA. Now I'm going to focus on the free online course on HIA, which has been developed by the NCCHPP. And you see here a kind of card, a card which is presenting the objective of this training course. The learning objective of this course is to recognize the fundamental of the HIA of public policy, to try to explain the step of a high-quality HIA, and to know the favorable conditions for the successful HIA implementation. Is a way to reinforce capacity building regarding HIA. The objective of this course is to assist participants in developing and enhancing the competencies required to properly conduct an HIA of public policy. The target audience is practitioners, professionals and also decision makers active in public health and in other related sectors from government and non-government organizations, but also any person who is interested in public policy and their impact on public health. You just need to have, a small understanding of what is determinant of health, because this is the basis for using HIA, and you don't have too much requirement for people to follow this course. Here are some general information regarding the HIA online course. It consists of 9 online modules, including videos from experts from the field and different learning activities, including questions and case studies and various practical tools for performing HIA. And it's accessible to you 24 hours, 7 days, open registration. You just need to register it, and you have permanent access to the course. And it's available in English and in French. As far as I know, only free online course which is available in English and in French at the international level. And once you have completed the training, it's possible for you to ask or to request for to ask for a certificate of completion. And yes, you will just have to send us an email, and then we will try to provide you with this certificate. Here we can see, we can have an overview of the online module. Actually, this online module will help you trying to have a best understanding of each step of the HIA. We are talking about screening, scoping, appraisal, and if you want to learn more about this step, you can follow this course, because for each step we have a module which focus on this step, and it could be very interesting to try to go in depth with each step of HIA. So my last slide for my presentation regarding the HIA online class is just to say that this course is aimed to support the HIA practice in Canada, and the objective is to foster the HIA application to public policy, to promote the development of healthy public policy, and to catalyze the practice of HIA around the country, and also to offer the opportunity for capacity building. If you want to register, you just have to go through this link, nccchpp.ch/HIA, and then you will be able to register for this course. And to learn more about HIA, we have our web page, the NCCHPP HIA web page. We have full of resources linked related to HIA. You will find guidelines, you will find documents about methodology, about type of HIA, about how to implement HIA, about how to conduct an HIA process. And also there is a kind of society of practitioners of health impact assessment, which we call SOFIA in the US, and there are many resources regarding HIA, also some case studies. If you want to have a look about some case studies, HIA report, it's also possible to find these documents on this website. And there is another one also, the Human Impact Partners, is also in the United States, and it's also a very interesting website where we can find many resources regarding HIA and how to conduct an HIA, how to implement an HIA, and about example of HIA reports that could be very useful when we are conducting an HIA. So that was my last slide for my presentation, and I hope that you are able to learn a little bit about what is HIA. And thank you very much for your attention, and I'm available if there is any question. Thank you.
Thank you so much, Chair. No, that was great, and it's great to get a good overview, and it's also really neat to see how the modules are set up so that you can really have kind of like a short, high-level overview, and then also really dig into the details of each step. So that was great. Thank you so much. Please, I do encourage people to add any questions or comments they have to the chat box, and I think we're going to try to save some time at the end to go through them and answer your questions. And in the meantime, we have Gabrielle here, who will be presenting on her experience with the HIA process.
Hi, everyone. I'm very glad to be here today to talk to you about my experience. So we chose to work on the Strategic Transit Development Plan for our HIA. That Strategic Transit Plan was developed by the Regional Transit Authority that I will call the Authority to simplify in my next slide. The authority was created in 2017, and its mandate was to develop the first strategic transit development plan for the Montreal metropolitan region. The strategic plan is a 30-year vision, and its objectives are to plan, organize, finance, and promote transit services for the metropolitan region. The plan has to be in accordance with governmental and metropolitan orientations, of course. The authority was also obligated to consult regional departments, municipalities, and public transit organizations through the process. So on this slide, you can see the authority territory that is very large. This slide is to give you an idea of the context and the structure. The Regional Transit Authority, which is circled in purple on this slide, is a metropolitan entity and must comply with the orientations of the Montreal metropolitan region, which are determined by the provincial government. The authority plans and organizes the public transit organization services at the bottom of this slide. We officially began in February 2019, and we were supposed to finish in last December, with the adoption of the plan by the Executive Board, but as you can see, it's still not finished. The authority occasioned several delays during the process, so we are still working with them. The transit plan is now planned for May 2020. The delay was most welcome for us because such collaboration with the authority was new to us, and the way forward was a bit more complicated than is usual. For example, we established 3 different committees, one with the authority team, one with the 5 public health departments concerned. As you can see on the map, the authority territories is very large, as I said, and I had to work with colleagues in Montreal, Laval, Lanaudière, and Laurentide as well. And finally, the third committee was one with my colleagues in my department in Montérégie. The Montérégie team provide leadership and was in charge of the screening and the scoping phases. But we worked with the committee comprising the public health department, and afterwards we validated this work with the authorities team. Besides, during the writing of the HIA report, we had the opportunity to collaborate at several points during the year. The authority asked us to provide the feedback on 3 different preliminary versions of the transit plan. Also, they asked us to develop a rationale addressed to population regarding the effects of transportation on health. And we developed, in collaboration with them, a perspective on mobility inequities for disadvantaged populations, a new field of research for us. I won't detail everything on this slide, but briefly, this is our logic model with the elements of the plan that we analyzed on the left side of the slide. The health determinants affected in the middle, and finally, the potential impacts on health and quality of life. For all the elements analyzed, we used evidence, of course, that I will show on the next slide. We used scientific literature and systematic review on inequities, employment access, health impact of road transport, the best practices on a healthy built environment, and a lot more. We also used a lot of data. For example, the data most used frequently was the 2016 census data of Statistics Canada, and the Montreal Metropolitan Region's also survey, the Origin Destination Survey, and of course the road safety records. One of the main analyses carried out concerned the mobility of vulnerable population toward employment zones. We developed a transport vulnerability index, and we were able to map the sectors where a high proportion of vulnerable persons live and their working sectors. We were also able to evaluate the distance and the time traveled to go to work. A lot of sectors had no transit options at all, or a very poor one. So a majority of these people were driving to work. The transit services are very well developed to accommodate employment in downtown area, but a majority of vulnerable population also work in the industrial or retail sectors, which are mostly on the outskirts of downtown. As we know, car possession is not cheap, and the use of public transportation could reduce the expenses of households in need. So one of our recommendations was to prioritize the increase of transit service between vulnerable neighborhoods and their employment zones. Because the HIA was based on a plan and not a project, the recommendations are not very specific. So we made some recommendations to promote the increase of multimodality, for example, pedestrian and cyclist infrastructure near the transit access points. Another one, rethinking the design of park and ride lots for transit access points to make sure that pedestrians, cyclists, and buses have priority over car access. And another one, to prioritize the intensification of public transport service along a dense, mixed corridor where there is already a living environment. And now the challenges, because there was a lot of challenges. As I mentioned before, the HIA was based on a plan, not a project, which is less common to us. Well, to me, actually. So the recommendations were more challenging to make. We had to write a HIA report, but the authority also asked us to make other contributions during the year, which took time to organize. Of course, changes in schedules are common during HIA projects, but it's a real challenge to address these. The scale of the project was also a challenge because it involved 4 other public health departments, so a lot more professionals to manage. And as I mentioned before, I was also responsible for the coordination of 3 committees. And to give you an idea, a basic HIA project usually involves a maximum of 2 committees. Because I had already participated in several HIAs in the past, but as a contributor, not as a project manager, I was already familiar with the HIA process. And but the course helped me to organize my work. It helped me with the use of tools. For example, I use the tools for the scoping phase and for developing the logic model. The course also helped me to formulate appropriate recommendations. And I think that's it for me. Thank you very much for the attention.
That's wonderful, Gabrielle. Thank you. Thank you so much for sharing your experience. And it seems that from what you were saying, the need for collaboration in the HIA process is so important, and sometimes maybe also a bit of a challenge when you're on a tight timeline. So I will then now move on to our question and answer period. So I do encourage everyone, if they have any questions or comments that they'd like to ask of our presenters today, to please post them to all participants in the chat box. I guess in the meantime, we'll get started with what we, some of the ones that have come in so far. So I think our first question here for, I think either Tierno or Gabrielle, if you have any anything to add, but given that Health Canada has published their HIA guidance in 2004 and that it never really received much uptake in environmental assessments, how do you see HIA moving from kind of the presentations, reports to implementation under IAA?
I think with the new the new impact assessment agency, it's not anymore an environmental impact agency, it's an impact assessment agency at the federal level. There is a way to incorporate or to integrate health issues into environmental assessment or impact assessment or any type of assessment. This is a good opportunity, and I think that there are several discussions at the federal level about that, about also this new agency, and that will be a good opportunity to try to work with the other assessment tools, and then to see how will be the best way to integrate health issue into either environmental impact assessment or strategic environmental assessment, other type of assessment, or how to conduct HIA as a standalone in evaluating a proposal. That's a good window. That's a window of opportunity to promote HIA at the national level here in Canada, I think.
Awesome. Thank you for your insight on that, Tierno. Moving on, I think maybe a bit more of a comment, but it appears that the health impact assessments have only really caught on more so in Quebec and has limited implementation in Toronto Public Health. Do you have any comments on whether you think that is and why you might think that is?
Yeah, actually, HIA is very well implemented in the province of Quebec. First of all, this is due to the section 54 of the public health law here in Quebec, which stipulates that the government, the Ministry of Health, is going to advise the other ministries regarding health issue. And also, we have what we call the policy government for prevention in health, which is trying to promote the use of HIA at the local or regional level here in Quebec, in partnership with the public health authorities or public health agencies and the municipalities. But in Ontario, in Toronto, we have also another tool which is quite close to HIA. It's Health Equity Impact Assessment. As I mentioned during my presentation, health equity impact assessment has the same steps as HIA. The difference is that when you are undertaking health equity impact assessment, you have to ask at each step of health equity impact assessment which are the equity implications. And I know that also other provinces are still reflecting on how to use HIA or to use health equity impact assessment, or they really want to have an idea about Quebec experience regarding HIA and see how they can adapt this experience in their own context. And for example, in BC, in public health law, in Public Health Act, there is Section 61 of the Public Health Act, which required the use of HIA. And also in Toronto, HIA has been applied to several project policy or program in partnership with the City of Toronto and also the Toronto Public Health. And there are some examples about how HIA has been applied there.
Thank you, Tierno. It sounds like there's definitely a lot of lessons learned and examples to pull from in provinces across Canada. So I guess the next question we have is about the online course, and we were just wondering, Tierno, if you can maybe reiterate how the online course works in terms of is it a cohort-based or is it independent learning, and is there a start date, or can you sign up at any time?
It is an independent learning. First of all, we had a course, a formal course on HIA. That was not an independent learning. We had like an instructor which helped the participant moving through this course. But now we decided to have an independent course. And you are not going to find an instructor there, but it's possible in case of you have some questions or you need some information or data or anything else, you can just contact us through an email, and then we will try to answer or to give you or to provide you with the things you need for following the course. It's really an independent course. There is no instructor behind people, but that help you, learning as you want. You have you can have your own time and for trying to go through each module, and it's a way. It's a flexible tool to help people according to what they need to find the best way of learning HIA through this course.
Great, thank you, Tierno. I think that's very, very clear, and it's great that people can sign up and complete the course whenever. The next question we have for Gabrielle is we're wondering if you can give us a bit more detail around some of the key issues that came up in the scoping stage, such as how it was appraised and eventually resulted in a recommendation. And I think also maybe related to this is how the HIA for the Strategic Transit Development Plan kind of came to be. So was there a public health agency champion doing an HIA on this area, or does Quebec require that you complete an HIA? Is there what sparked the need I think to do an HIA?
All right. For the answering the first question, for one example, there was total absence of any mention of mobility inequities in the first version of the plan. And as the public health department, it was one of our priorities to give access to transit to vulnerable population, of course. For the first meeting with them, the authority was open to look at that aspect with us, but one problem was the board. They were not very convinced. So one of our first work with them was to develop something to make sure that the board was with us and to convince them that developing a priority in the plan that was addressed to vulnerable population to give them access to their employment zone was very important to add in the plan. So that was a good success for us for that aspect of the plan, because now it's included in the second version of the plan. It was included in the second version of the plan. So we have a little success here to celebrate. And for the second question, that was concerning the first one. No, second one.
Yeah, so I think just I guess maybe a bit more about how it came to be in the first place. So was there a requirement to do an HIA in this area, or was there a specific agency that was championing doing an HIA? Like where did it all start?
Okay. No, well, actually, the authority before the beginning of the project, the authority organized a lot of consultation with a lot of partners in the metropolitan region. We assist to those consultation, and well, we just offer them to engage in a HIA with us, and the people that was the people that we met at those consultations were very open, and they asked us to go to the board to present the project, and we had the authorization of the board to go further with the HIA project. So that's it for the beginning.
Thanks. That's very interesting. So I think another question related to methodology of HIAs. Do you think there are any kind of key gaps that still exist in HIA practice that might limit its potential? And if so, are there any research areas that you think should be a priority moving forward?
Yeah, I think that we have to continue the research on the aspect related to the quantitative analysis in HIA, because it's sometimes quite difficult to try to link an issue with health when we want to use a quantitative approach. And we really have to focus on, I think, on this aspect in order to improve the prediction when we are conducting an HIA. I think data access and quantitative approach are fields that we need to work on in a kind of when we are doing research or something like that, because this is the challenges we face. One of the challenges we face when we are conducting an HIA, how we can best predict the potential impacts using a quantitative approach. We have to work on this type of topic. I know that there are some models that we can use, but sometimes we don't have the data we need, and this is also difficult for us. I don't know if Gabrielle wants to add something about her challenges regarding methodology on HIA, and I think she agrees with me that this is one of the challenges that we have, the quantitative approach, quantitative impact assessment when we are doing an HIA.
Thank you. Yes, yeah, that makes a lot of sense. There's a few more questions, and we have a few more minutes. So I will just continue to power through them. I think the next question really wants to know about how do you know if a HIA has been done for a specific project? Is there a place that's publicly accessible, or is there another route that you'd need to take? I think the interest for here would be to see if there's been an HIA that's been conducted for the Trans Mountain Pipeline project.
That's an interesting question. Usually we have some website, like here in Quebec, we have a website where we can find the HIA report which has been conducted in the Montérégie region. And I know that also the Quebec Public Health Institute is trying also to create a website where we will be able to find some HIA reports. And also we have a website where it's possible to find some HIA report which has been conducted in Quebec City, here in the province of Quebec. This is the way we use to be able to have access to this report if they are not confidential, because this is important. Sometimes they are not free access, and if they are free access, usually we go through website and then trying to find the report.
Yes, I think that's often the case with a lot of reports, and I think it'd be really nice to have it all in one central, publicly accessible area, but that's not always possible. So we have a few more questions just about the online course, which people seem to be very interested in. So I guess Tierno and Gabrielle, if you know or have experienced or have an experience with how these questions, I guess on average, how long do you think it takes to complete the course? And is it actually freely available, or is there a fee?
Usually we say that it's going to take 5 hours, but I think that could be take more. You see, it depends on the person and how this person wants to learn about HIA, how this person gonna have time, to go through all these modules. And I cannot exactly say what time we need to go through all the modules. It depends on the person who is learning and how the way this person is using the free online course. But what we said is that if you are doing that so quickly, you can maybe take 5 hours to go through all these modules. It really depends on the participants, and that's why it's accessible 24 hours and 7 days. I think the best way is, just to see how do I have enough time? Do I want to go through all these modules, and how I'm going to organize that, since maybe I'm also working at the same time, or I have another duty at the same time. The person has to organize himself as he wants with that course. It's really flexible.
Wonderful. And then just to confirm as well, it's a free course, right?
Yeah, it's free course. Yeah.
Yeah, so no tuition fee. Yay. Awesome. Okay, so I think our last question maybe before we just wrap up here, and it might relate to what we were talking about earlier about other guidance documents or online courses, but have either of you heard of a professional development opportunity that looks more closely at the health equity impact assessment?
I know that if you want to find really very interesting information regarding health equity impact assessment, the Ontario Ministry of Health, through their website, it's possible to have information regarding health equity impact assessment, and also it's possible to have access to a course on health equity impact assessment. But I don't know if it's a free online course or not, but I know that there is a course on health equity impact assessment, and which is provided by the Ontario Ministry of Health.
Wonderful. Yeah, that's great. And thank you so much for sharing all of your insights with us and answering all of the questions so well. So thank you so much for that. I think that we, in the last 5 minutes, please, if you do have any last-minute questions or comments, feel free to share them in the chat box. And I think here as well, I see that Mylène just actually posted the link to the course. So that's for the Health Equity Impact Assessment. So if you're interested, please go to the chat box and you can click on that and learn more about it. As we wrap up, I would like to ask that you please take the time to answer a few evaluation questions using the polling question panel on the right-hand side of your screen. Your feedback is really important to us, and we will continue to use your feedback and your insight and to improve our webinar series. So please go to the polling panel and answer the questions if you have the time. I think one more item that we'd like to share. So our next webinar will be in French, and Tierno will also be presenting on the health impact assessments at this time next week. So if you're interested, we have a new or different user story as well, if you'd like to join us for that. And our next English webinar will be looking at the newly launched quality assessment tool of community evidence that the National Collaborating Center for Methods and Tools has developed. So please join us for that as well. And then finally, if you do want to connect with us, or if you have any additional questions, we have our contact information here, and I believe Tierno and Gabrielle have also shared their emails if you'd like to get in touch. Yes, thank you again, everybody, for joining us. And I would like to just pass it over to Tierno and Gabrielle if you have any last words.
Thank you very much. I hope that you are able to learn a little bit about HIA, and please feel free to send us an email if you need any information or if you want some resources regarding HIA. It will be a pleasure to help you find the document or the report or resources you need.
And thank you. If you have any further questions, feel free to email me. I will be very happy to answer you.
Wonderful. That's great. Well, thank you so much, and I hope everybody has a wonderful day.